question will be, what are the aspects important to assess when we want to know whether or not someone will act out or not his or her sexual fantasy? So I am a neuropsychologist, so you will see the neuropsychology color in my work, and I'm a professor in the Department of Psychology at University of Quebec at Trois-Rivières, which is a midtown university at the heart of the province of Quebec in Canada. And I also work at what was called the Philippe Pinel Institute in Montreal, which is now a National Institute of Forensic Psychiatry for Canada. So that's the reason why I worked in the medical legal forensic settings as a researcher. Now, the first question is will be, what is exactly a sexual fantasy? It is really simple. The definition of a sexual fantasy is pretty simple, but there are two main words that are important. First is imaging, mental imagery, and the other is arousing, of course, sexually arousing. So this means that to have a sexual fantasy, I would say, of course, you need to have some imagination capacity. And as we will see today, it's the capacity to imagine is not the same from people to people. It's really different among individuals, and especially among people who had committed a sexual offense. And by the way, I will say today, sex offenders, I know I wouldn't write it, but it's shorter than men who had committed a sexual offense. And also it's sexually arousing. So if you have a fantasy and you're not aroused sexually, it's not a sexual fantasy. That's simple. Which the things that are more important is to know that it could be a pretty specific and long scenario, but it could also be a fleeting thought that just pops up. So it's not necessarily a scenario. It could be an image that pops up. And also, it could be associated with either a positive effect, but also negative effect. So what we take for granted usually is that a sexual fantasy is necessarily positive because it's associated with sexually arousing, but it's not. Sometimes it's not necessarily the case. And people could come and tell you as a therapist or counselor that they have fleeting thoughts, sexual, at the wrong moment, inappropriate moment, in a professional meeting, in a family dinners, and they don't want them, and they are mad about it, and so it could be kind of colored by obsessional characteristic. So it could be spontaneous or deliberate. The difference is really important. Previously experienced, this is pretty common, or purely imagined, realistic, odd, or unrealistic. So this is the main definition, of sexual fantasy. This is the one that we will use today. More interestingly is the reason why we should study sexual fantasies. First of all, it's almost universal, but it's not. Some people never had sexual fantasies, between 1% and 5% of the general population. Some people they call themselves asexual. They don't have sex drive. They don't have sexual interest, especially with other people. And the majority, among about 60% of them, did never experience any sexual fantasies. It's interesting to know that 40% of them still have sexual fantasies. But again, most of the general population have sexual fantasies. As I said, between 95 and 99%, but they are still vastly understudied because it's still a taboo subject. It's really personal, of course, personal matter, and it's really difficult to obtain grants to do research about that. Although today it's less difficult than it was.